Hello, friends. I want to tell you my experience about a patient who came from the United Kingdom and he came for bilateral varicocele surgery. In his surgery, this patient has more abundant right-sided varicocele disease. This is rare. Normally, varicocele is more abundant in the left side, but sometimes, occasionally, it happens. And in last month, I see three cases like this, the right side prominent varicocele cases. So it happens. But the most important part, this patient has small epididymal cysts, and he was curious about these cysts. He had concerns about the cysts, saying that he had this pain because of the cysts, and he has urethral pain, and he has pain during ejaculation. He has pain during sitting down on the perineal area, which is the sitting area. And I said to him, it's very, very rare or nearly impossible to have pain related to the epididymal cysts. When they get too large, the pain may happen. But when they are small, like his measurings, it's very, very rare. So what we did, we said there may be prostatic inflammation in this patient. So we had investigations about that. So, prostatic inflammation related to varicocele. This is an unknown situation. We don't have this issue on the books, in the literature, anywhere. But in my experience, I noticed that there is too much big relationship between the varicocele disease and the prostatic inflammations. How did I understand it? There were some of my patients had left testicular pain. They had varicocele. I cured the varicocele. There was no varicocele anymore. But they had continuing pain. And when I investigated, I find out prostatitis in these patients. So now I am sure that prostatitis and varicocele have some relation. I think it is because of the sperm channel, which is located just beside the varicose veins, and the pressure inside the varicose veins can be radiated throughout the spermatic channel to the prostate, and this pressure increase may do some inflammatory changes inside the prostate. So I believe, compared to normal population, varicocele patients had much more prostatitis, prostate inflammation. In this patient, we take out his cysts, but these were not important. So when we examined his prostate under anesthesia, we find out that he had too much inflammation in the prostate. What we do here is we put our finger from anus and we do rectal pressure, squeezing of the prostate, and when we do it, a lot of fluid come out in prostatitis patients. In normal population, we don't see that. Nothing comes out in normal men. But if some fluid, prostatic fluid is coming out, this is a proof for us for the prostatic inflammation. So as a summary, I can say we always have to think about prostatitis additionally to the varicocele. If there's a pain issue, if there is a this ejaculatory pain, dysuria, and related urinary symptoms, prostatitis must always be kept in mind because it has too much relation with the varicocele disease.